Because oncology is a illness that most people think is the end of life and oh gosh, my family member is dying, there are a lot of support for patients. Therefore, a lot of patients, relatives, friends and well-wishers follow them to clinic. The building that we now exist in is really small. We have 6 chairs in the waiting area, and then we cannot accommodate patients and relatives. If it rains, relatives have to find their cars. The sun is too hot, relatives have to find under trees. This situation was untenable. Therefore, the proposed move is welcome. I've been to the place, I've visited. The ambience is good. I know there is some construction to be done to make it fit for purpose at this time. And I do believe and I do feel that move, we will be able to enhance the care we give in various ways, because then we have space. Relatives will be able to come and sit with patients. That kind of intimate support will be there. For me, if I have to say yes or no to the move, I would have said yes in 2012, 2013, thereabout, when the population started growing. That is after we had started in 2010, and patients knew that we had services available in Tobago, and they start migrating from Trinidad. Definitely, patients, relatives would be happy. Patients would be happy. Staff would welcome, because the unit is definitely tight. You can't move a wheelchair around the unit. There's one patient toilet. The situation is not good as it is.
About 40 years ago, I got into an accident, and I got a blow. It's terribly stuff now. And I had a scar. And I was always conscious of feeling the scar. So one day I felt it a little uncomfortable. And I started to test, to check it, until I decided to have a checkup. The doctors and the nurses and here, they were really nice. You could see they were operating under duress. The place was uncomfortable, inadequate, not comfortable to sit for privacy. And you know, but because it's cancer, because you're doing it, and you want the service, you go. If it was for any other reason, you would have looked for somewhere else to go. But they needed, and they need to be approved.
This is where, for instance, if I have to speak to a family about what's going on with a patient, I have to have the patient and all the relatives in this space. It's not really conducive to that sort of conversation, especially if the news is not good. Normally after chemotherapy, we want to see you a week later to see how you're going and check your blood count, and then a lot of times that's a second journey to St. James. A lot of people would just disappear for 3 weeks, and we hope we see them when the next treatment session comes around. It would allow for patients to, one, have a bit more privacy, and even have a relative come and spend some time with them while they're doing their treatment, if the treatment is going on for hours. Having greater privacy would make people at least more at peace to know that, you know, just because I show up at that building, it doesn't necessarily mean that this is what I have. Treatment in a more beautiful environment, a more calming environment, could only make things easier for patients. They're going through enough as it is, just with the illness and diagnosis, and coming to grips with that.
I'm so happy to know that you are doing something about it, but it's about time.